Performing the pivot shift test. The pivot shift test assesses the stability of the anterior cruciate ligament, or ACL. The basic principle is to evaluate whether the pivot point of the knee joint is relocatable, or in other words, shifts under certain circumstances. The pivot shift test is performed by rotating the lower leg, and thus the tibial plateau, inwards against the femoral condyles. Physiologically, this causes the cruciate ligaments to wind around each other. In doing so, they disrupt internal rotation and subluxation, so that neither the tibia nor the pivot point of the knee can be shifted any further. In case of ACL injury, internal rotation will cause ventral subluxation of the tibia, resulting in a shifted pivot point of the knee joint. Clinically, the subluxation is provoked by internal rotation. By applying axial compression directed cranially and additional valgus stress, which means putting pressure onto the lateral knee joint directed medially, the tibial plateau gets pinched underneath the lateral femoral condyle. For this examination, the patient's hip should be flexed approximately 20 degrees. To evaluate whether this maneuver does in fact cause subluxation, the leg is flexed approximately 40 degrees. This results in a functional transformation of the iliotibial tract, which runs from pelvis to tibia, turning it from an extensor into a flexor. In case of tibial subluxation, flexion of the leg creates tension of the iliotibial tract, which ultimately results in sudden repositioning of the tibia. The lower leg flips dorsally, which is clearly noticeable. The pivot shift test is positive, thus making a lesion of the ACL very likely.